As we say in Georgia, good afternoon, y'all. Is everybody doing okay? Doing well? Good. My name is Molly Nettles, and I practice out of Georgia. I've been an occupational therapist for almost 18 years now. I've been a CLT since 2003, and my goal of this talk is just to give you one more tool in your toolbox that you can use to take care of yourself. We're going to go over self-manual lymph drainage. How many folks here have had manual lymph drainage performed on them before? Oh, quite a bit. How many were taught how to do self-manual lymph drainage? Okay, good. So fair enough number. Very good. I have nothing to disclose. So when we talk about self-manual lymph drainage, it's important to note that MLD is just one component of CDT, which is complete decongestive therapy, which is the treatment that we use for any type of swelling disorder, really, lymphedema, lipedema, chronic venous insufficiency. Along with MLD, we also must use compression in the form of compression bandages or garments, as we just heard about with Yvonne. Exercise is a very important component of CDT, as well as skincare and, of course, patient education. As a therapist, it's part of our responsibility to give you all the tools that you need to be independent in your self-care. So what exactly is manual lymph drainage? When we talk about manual lymph drainage, I hate to use the word massage, because when you hear that term, it sounds like a real deep, heavy kind of milking, and that's not what MLD is. It's a very, very light technique using gentle pressure to move fluid in a specific direction. We use a very light directional pressure, and when we do self-MLD, typically we begin proximally, work distally, always moving the fluid centrally or to the trunk, to the heart. We talked a little bit earlier about the structure of the lymphatic vessels. And when we are performing self-MLD, we are actually getting a really good skin stretch that promotes stretching on those anchoring filaments, which actually helps to pull open those lymphatics, changing the pressure gradient, allowing fluid to come in from the interstitial tissue and become part of the lymphatic system. So what are some of the effects of MLD? Well, we know that MLD has a pain-relieving effect. It can be very soothing. It has an analgesic effect on the surrounding tissues. MLD is used to decrease swelling, increase lymphangiomotoricity, and we also know that it increases venous return as well. And when we talk about manual lymph drainage, it's important to understand lymphatic mapping, or the way that our body flows. Basically, our body is divided up into sections called lymphatomes, and each section, or lymphotome, drains to a specific cluster of lymph nodes. And you can see by this picture here that the body is divided up, at least in the trunk, into quadrants. You have large clusters of lymph nodes at your cervical region, up at your neck, underneath your armpit, called the axillary nodes, and the inguinal nodes, and behind the knee there as well. We also have large clusters of lymph nodes at our neck as well, which is where we always start the MLD process. And when we do MLD, what we're going to do today is, this is going to be interactive. I'm going to teach you how to do 2 specific strokes, and then we're going to apply that to a sequence that we use on the arm and on the leg. And I would ask everyone now that has on a short sleeve shirt, or if you have access to your arm, I want you to take out a pen, if you can, and I don't know if you can see this or not, but I want you to draw a circle on the side of your arm, if you have access to your arm. The side or the front will do, just above your elbow. I'll give you a minute to do that. And I'll explain why we're doing this here in a minute. So when we talk about MLD, when we do each stroke that I'm going to teach you, the stroke really is composed of a working phase and a resting phase. In the working phase, we are applying a stretch to the skin, and we are moving that fluid upward in a half circle. We're going to get a real good skin stretch. That's the working phase. In the resting phase, we are releasing that skin, allowing it to go back to its original position. And this will make more sense here in just a second. So we're going to start with the stationary circle. And what I want you to do is to just take your hand, and we're going to be using the palmar surface of your hand, and I want you to put it right at the top of your arm. Okay? So in the working phase of this stationary circle, we're going to move that skin halfward, half circle up, and then we're going to release. Half circle up, and then release. And I want you to be sure that you're not squeezing. We're resting our hand on the skin, directing that fluid in a half stretch upward, and then releasing. I don't want you to slide. I don't want you to squeeze. I want you to pretend actually that your hand is superglued to the side of your arm, so it's not sliding. So in the working phase, half a circle up, get that full stretch, and then allow that skin to go back. Half circle up, allow that skin to go back. And if you're doing it properly, you should actually see that circle moving, even though it's below the area that you're working. Are you seeing that? If you're seeing that, then you know that you're doing it correctly. You should see that circle actually moving up, and then in the resting phase, it's going back to its original position. No sliding, no squeezing, relaxed hand, relaxed fingers. Make sense? Okay, so that's what we call the stationary circle. Hello? The other technique that I wanted to show you is what we call the pump technique. And this is how that works. I want you to take your arm, and you're going to just relax your fingers and your thumb. Let's start down by the elbow. So your fingers are relaxed, your thumb is relaxed, wrist is at a 90-degree angle, perpendicular with the skin. You're going to stretch down, stretch that skin downwards, and then up. And actually, I'm going to do this above the circle that I made. Push down, stretch up, relax. Half circle up, relax. Take it to that full stretch, and then allow that skin to go back. You see your circle moving? If you see it moving, you're doing it correctly. That circle should be moving even though you're not working right over the circle, you're working just above it. So that shows you that when done properly, we are actually working the lymphatics, not just the area that we're touching, but we're working the lymphatics below that with the skin stretch. Okay? We just went over abdominal breathing, so we'll skip through that. Okay, so let's go through an arm sequence, applying those two strokes that I just showed you, the stationary circle and the pump. We're going to start right at the neck, and I think it's easiest if you cross your hands like so. And we're going to do a stationary circle. Oops, I'm blocking my mic, I think. Can you hear me okay? Okay. We're going to do a stationary circle downward. Move my hair out of the way. 5 to 7 times. Same position. We're not really sliding. We're getting that skin stretch. And it's very, very slow, very gentle. You never want to be in a hurry when you're performing MLD. You want to be relaxed and not rushing. Okay? We're going to drop those hands a bit, come closer to the base of the neck, and we're going to do that same stroke. Five to 7 times. Good. Okay. And then we're going to come to the area right above the clavicle. You can cross hands if you like. Sometimes it's easier to do it this way. I prefer to cross We're going to do that same movement. So quiet in here. Soothing analgesic effect. Okay, very good. Okay, so if your arm is heavy, you can rest it right on top of your head, and you're going to use the flat palm, the palmar surface of your hand, and you're going to do those stationary circles deep into the axilla, deep into those nodes that are in the armpit. And you would do this 5 to 7 times before you started the arm. Basically, we're working on getting a skin stretch. Some therapists will tell you to circle up. Some therapists will tell you to circle down. It doesn't really matter, I don't think, because what we're working on is really that pressure over the nodes and getting that skin stretch. We're stimulating those lymph nodes. Yep. Okay. When we talk about applying MLD to the arm, we're going to start at the top of the shoulder here. And if your arm is heavy, sometimes it's easiest just to prop it up on the table. Another way of doing this is we'll go through is if you can hold on to the top of the door, hold on to a shower rail, something that you can use to support your arm if it is pretty heavy. And you're going to start at the top of your shoulder, and we're going to do that stationary circle again. Really getting a good skin stretch. Your hand should not be sliding. You should not be squeezing. You should be using the palmar surface of your hand. The more surface area you can cover with your hand, the better. Okay? We're going to come down to the side of the shoulder, and we're going to do that same thing. As you do this, you should see that circle moving on your arm if you're doing it properly. Half a circle up, relax. Half a circle up, get that full skin stretch, and then relax. Working phase, resting phase. Working phase, resting phase. Stretch that skin, relax, okay? Then we're going to move it down a hair, and we're going to do the same thing. Side of the arm. Now I'm on top of my circle. If you're doing this properly, if you're right above your elbow, you should see that skin moving in your forearm. Do you see it? Good. 5 to 7 times. Going to turn your arm this way. We'll just pick one spot for time's sake. Doing that stationary circle. 5 to 7 times, good. And basically what you would do is you would start proximally, if you're going to do your entire upper arm, dividing that arm into sections, starting proximal, working distal, always directing that fluid up. And you can turn your arm so that you can get pretty much any area that you can reach. The other stroke that you can use on your upper arm is that pump technique that we just reviewed. Place your hand, and we're going to add some movement to it. This might get a little tricky, but give it a try. Starting just above your elbow, perpendicular to the arm, fingers relaxed, thumb relaxed. We're going to do a skin stretch this way, directing that fluid up and then releasing. We can add movement to that. Shouldn't be painful. If you feel pain, you're probably pressing a little bit too hard or too deep. Hand is relaxed. Very good. Okay. Coming to the elbow. There's many different ways we could work the elbow, but just for simplicity's sake, we can do a little scoop over the inside of the elbow. Patients tend to be a little lumpy, bumpy in this area, so you might palpate a few of those nodules. Another way to do the elbow crease. is to do some circles, stationary circles over that elbow crease as well. 5 to 7 times. Okay? And then working the forearm the same way. Starting close to the elbow, doing those stationary circles. Stretch and release. Allowing that skin to go back to its original position, not pressing too hard. Very gentle. Very easy, no squeezing. And then moving a bit more distally, working the fluid in that same direction. Very gentle. Covering as much skin surface with your hand as you can because it's going to be more effective. You're going to move more fluid that way. The more surface area you can cover, the more fluid you're going to move. And then you can turn your arm any which way to make sure that you cover all surface area of your lower arm. Okay? You would just start proximally 5 to 7 times each spot, working distally, always moving that fluid up. Okay? Good job, everybody. We can apply this to the legs as well. First, we would do that deep abdominal breathing that we just learned about. Okay? And then, before we started the leg, we would work on clearing the nodes at the groin. Everybody has this natural crease right at the top of the thigh. If we've got pannus, sometimes it might be easier to do this reclined or lying down so you can move that pannus out of the way a bit so that you can have easier access to the lymph nodes at your groin. But what we're going to do is we're going to scoop up over those nodes right at the groin 5 to 7 times each spot. And then we're going to start the leg. It's easiest to do if you can prop your leg. Sitting on the edge of a bed, propping it up, sitting in a chair, putting your foot up on a stool. We'd start proximally, and you can use one hand or both hands. You can do this in sitting. You could lean over. You could reach down with one hand. You've got to just adapt to what you can reach and what your body can do. So I'm just going to prop my foot up on the chair. And we're going to start proximally. You can use 1 or 2 hands. And we're going to do those stationary circles up the side of our thigh as well. FYI, you never want to do this over clothes. It's got to be skin on skin. Because if you're doing this over clothes, you're just going to slide. And you're not going to get a real good skin stretch. So maybe best time to do this would be right before a shower, right after the shower, at the end of the day, because you really do need skin-on-skin contact. Okay? And you would just move down closer to the knee, work your way down, doing those stationary circles, directing everything upwards. You'd work the rest of the thigh the same way. You can work right inside the knee with one hand, with 2 hands. Okay. You can work your lower leg, much the same manner, but you can use 2 hands on the leg. Doing those stationary circles, really getting that good skin stretch upwards. 5 to 7 times each spot. Working down distally, moving all the fluid proximally. Make sense? Does this look familiar at all to what you've had in the past? Yeah? Good. Okay. That's it.